Let us talk about the placebo arm and a randomized controlled trial. What is a placebo arm and why is it important? First of all, it's important to emphasize this, and I'll talk about this a little bit later in the video. The placebo arm of a randomized controlled trial is something that exists as the essence. It represents the essence of what modern scientific medicine is. That placebo control is the exemplification of that, the essence, the critical ingredient, or one critical ingredient, but one of the top one or two or three critical ingredients in what modern Western medicine is. Why? Throughout all of human history, doctors, medicine men, shamans have treated their patients, their tribe members, their fellow villagers, using clinical experience, using the experience of what has worked in the past and what has worked in their own personal experience. They use this because that is the best way, before science came along, that is the best way to use the wisdom of the past, traditions, to then influence, potentially in a causal way, the events of the present. So to cure disease, if you see that it cures disease in the past, some herb cures disease in the past, you use it in the present. Or if you have some luck with it, or it has some efficacy, it seems to maybe work or help a little bit, you use what you learned in the past in the present. What's the problem with this? A few things. Diseases spontaneously often will get better on their own. And so what looks like a treatment effect, perhaps it happens the next day, things get better the next day. What looks like a treatment effect is in fact not a treatment effect. It's the result of things spontaneously getting better. And you see that once with one herb, and you see it again and again. Eventually you start to believe that herb treats that disease. And let's say it's a disease like a cold. Well, a cold almost always gets better. So how would you ever tell whether you get better faster or slower based on experience? Or you get better more based on experience? It would be very difficult because it always seems to get better, no matter how you treat it. And so all around the world, cold remedies, traditional cold remedies, are quite various. They're quite different. Totally different kinds of folk remedies. In fact, there's just thousands of folk remedies for the cold that are entirely different compounds, entirely different herbs. And why? Because the cold spontaneously tends to get better. And it's very hard to tell when your treatment is helping. Okay, the other reason is giving a treatment in and of itself, whether or not it works, whether or not it has any biological effect through a mental effect, can help the disease process. There's a whole field called psychoneuroimmunology. And there's a very famous scientist at Harvard. His name is Kapchuk. This whole field is dedicated to understanding how these kinds of effects happen. So you can actually give somebody who has Parkinson's disease, the drug for Parkinson's disease is called L-Dopa. You give it to them, say, 6 days, and then the 7th day, you don't give them L-Dopa, you give them a placebo, and you call it L-Dopa. they will have the same effect in the brain on dopamine with the placebo as they have with L-Dopa itself. So placebo can mimic, through behavioral conditioning, through all sorts of very interesting mechanisms that we're still taking apart, it can mimic through expectation and through other mechanisms that are still yet to be fully elucidated, the drug itself. This goes with growth hormone, cortisol. You can do this autoimmune drugs. You can actually affect the immune system. Give somebody an immunosuppressive drug for 5 days, then give them that immunosuppressive drug under the same conditions. They get an immunosuppressive effect. Cyclosporine, they've done that with. And there's case studies, they've treated people this way. Okay. You can do this with ADHD. Okay. So, back to the placebo-controlled trial. The placebo itself can induce an effect. Okay? So, because the placebo can induce an effect, because simply seeing a doctor can produce an effect through similar mechanisms as what I was just discussing earlier, it can make things better, or it can make things seem better. And because of regression to the mean, and because of some other factors that are also important to control for, that I cannot discuss at length in this video, we have placebos. A placebo arm. The group that is given the sugar pill. One group is given the active treatment, the other group is given the sugar pill. The group that is given the sugar pill is given that to see if the sugar pill is different than the active arm. That is to say, if there's any effect of the active drug that is greater than regression to the mean than placebo. What does this have to do with the heart of Western medicine? Well, in the past, instead of having a rigorous trial where we compared the effects of seeing a doctor, getting a fake drug, etc., to actually seeing a doctor and getting the real drug, we would use clinical experience with many drugs that did not work. Some did, but many that didn't as well. And we would be prone to error, prone to biases, prone to believing things worked much better than they did. So one of the first controlled trials, if not the first controlled trial, was done on bleeding. That is to say, whenever somebody gets an acute illness, acute infectious disease, you cut them open a little bit and you bleed them. They lose blood. So you bleed out it was thought as you bleed out the toxins, you bleed out the bad humors. It was the old belief. And by bleeding out the bad humors, then you eventually could help the person. And you'd also give them enemas, you'd induce them to vomit, etc., to get all the bad things out that were causing the illness. Okay, cool. They did that. I think it was in the 18th century or the 19th century. It was one of the first clinical trials ever. They did that, and they compared the mortality of people with these acute illnesses, and they found out that the mortality for people who were bled was much higher than for the people who were not bled. Wow. But that's interesting. Why is that interesting? Because bleeding, and this approach to medicine, bleeding and purging, and using laxatives, has been a mainstay of Western medicine for thousands of years. It's probably the most, if not the most important practice of Western medicine for thousands of years. And yet, this mainstay that's been used on millions of people throughout the history of Western medicine has probably caused the lives of many thousands, if not millions of people. It has probably killed a lot of people. And that was arrived at through clinical experience and theory together. So, once we have the randomized controlled trial, though, we can know, okay, does this really work? Not according to my experience, Not according to what seems to work, but medicine says may or may not work, but what actually does work. This happened more recently in the CAST trial. In the CAST trial, which was conducted starting in the mid-1980s, they looked at the role of drugs that normalize the heartbeat rhythm after somebody has a heart attack. So somebody will have a heart attack. Their hearts will not beat in the same way that they did before the heart attack. You can give them a drug to make that heartbeat more regular and normal again. And that was the standard of practice for decades before the CAST trial, to give people a drug to make their heart beat normally again after they have a heart attack. And doctors swore by this. They said, these patients need their hearts to beat normally again, because this prevents an arrhythmia, that is to say, an abnormal heartbeat, which can prevent death and other bad outcomes from this abnormal heartbeat. So we've got to give people a drug that makes their heartbeat normally again. And what they did in the mid-1980s, they had what was called the CAST trial, where they tested this. They tested, compared to a placebo, the effect on death rate of giving people who just had a heart attack but have no other major symptoms this antiarrhythmic drug to make sure their heart beat normally again. What happened to the death rate? The death rate increased by more than 5%. Absolute death rate. So 1 out of 20 additional people died in the group receiving the antiarrhythmic drug. This was standard practice before the CAST trial, based on clinical experience, mechanistic rationale, a theory, and it killed people. This is why we care about randomized controlled trials and placebo controls, and we're interested in why and whether the placebo control is perhaps responsible for part of the effect, or is even better than the drug itself, if the drug itself is worse than placebo. But we think, based on what we see in our personal experience and what we think in our theories, that the drug should work, it should help. That's why we care about control groups. That's why we care about rigorous testing, so people don't die. And again, we have randomized controlled trials based on compelling, persuasive, mechanistic rationale for why a drug should work, clinical experience that it does. Of course it does. Of course it works. Of course it works. I've seen it with my own eyes. I've seen patients get just way better after I give them the drug. Of course it works. This is why we have randomized controlled trials, and we don't give people drugs and interventions based on things that we think should work or worked for us. Now, what is the role of using a placebo? What if a placebo actually itself can work and have an effect? Well, you can do trials on that as well. And why would you want to? Let's talk about Reiki, right? Reiki is energy healing, pseudoscience. They came from the 19th century or the early 20th century from Japan, or an adaptation from a Japanese practice, Okinawan practice, I want to say. Karate also comes from Okinawa. Somebody can correct me if I'm wrong, but I believe it comes from Japan. And it's a new practice from Japan. It was developed in Japan in recent years during modernity. It's not a traditional practice. But it comes from Japan, and essentially you heal people through energy. Kind of a modern laying on hands. And it works online too. You can do it over the internet. Apparently there's studies now that are showing it works. What's the mechanism? Well, you can compare it to a placebo control. Some other kind of healing that's not Reiki. And see. And the mechanism for Reiki is placebo. So placebos can help people with disease. Why is it important to spell out, in that particular case, if placebo is the mechanism? Why is it important to spell why placebo works in that way? Well, because, let us say, and I don't know how much Reiki healers cost, but let us say Reiki healers are expensive. They charge a lot of money. They're highly trained. If so, and we know the mechanism of Reiki healers and we can reproduce it in a cheaper way, or if there might be some negative effects of having a Reiki healer. Maybe Reiki healers also have other practices where they give drugs and herbs and other things in addition to Reiki. I don't know. I'm not into Reiki. But let's say there's some negative things associated with it. Well, if we know the mechanism through which Reiki actually works, then we can reproduce and replicate it in a cheaper fashion and in a safer fashion, because we now have the pure understanding of why it works. Let's say it works through some pathway in the brain which activates the vagus nerve, which then innervates some other organs. And by modulating this vago-vagal connection, which is what many researchers suggest is behind a lot of the placebo effect, is the vagus nerve, and certain parts of the brain that activate the vagus nerve and then cause physiological effects in the body, because the vagus nerve innervates many of the organs in the body and can modulate their functioning. There's other mechanisms as well. Let's say that that's the mechanism. Well, if we could do that without the Reiki healer and the potential harms of the other things that Reiki healers do, then we can give people treatments more effectively and more safely. Okay? So even in the case where we're using placebo to our advantage, maybe some antidepressant prescription is also due to this, right? If we can find a safer way of giving that same placebo in a cheaper way, that's why we're interested. Because we're interested in helping people, and the more cheap and safe our placebos are, the more we can help people. If we're really interested in helping people. That's what I got into this for. Okay. So, in this video I discussed placebo-controlled trials. What is the reason we do it? How does that separate modern scientific medicine from traditional medicine? And why are we interested in, even in the cases where placebo is working, is operative? Why are we interested in the mechanisms? Because we're interested in things being cheaper and safer. We're interested in what is the most effective treatment through placebo-controlled trial. And in as much as we're interested in placebo, we're interested in as much as we're interested in placebo, we're interested in what is the most effective and safe approach. That's it. That is the comprehensive view of things. You can always say, my experience, my anecdote, it worked for me. Low carbohydrate diet worked for me. Homeopathy worked for me. But asking the question why helps us to understand, is there something more effective, potentially? And is there something safer and less expensive that we can give people instead, so that more people can share the benefits of what you're getting through your anecdote? Same goes with low carb. Because if it's mediated by more protein, then maybe we can just give you more protein. Okay? I hope this discussion of placebo controls, clinical trials, etc. has been helpful. I don't know why I have to keep explaining this. It's not rocket science. It's not controversial. There's not a discussion about it. Smart people should understand this. If you're smart and you're still having questions, send me some questions and we'll talk about it. Thanks for watching the video.